This is Grant's Production, live talk show, coming to you direct from the city of Tacoma, the city of destiny, 37 miles south of Seattle, Washington, in the northwest corner of the United States of America. And now this.
In the pharmaceutical companies today, most seen as launching pills, pushing pills. But Ardenna, what do you bring to the pharmaceutical industry that makes you separate as a drug rep when you enter a doctor's facility?
Well, diversity is certainly something that's lacking in the industry and certainly something that's needed.
And when you speak of diversity, I come from a clinical background myself, and we greet you at the door, you log in the medications, and you do even the teaching. But what do you mean as far as diversification?
Well, there's not a large representation of minorities in the pharmaceutical industry. And for the most part, only one perspective is being represented when you lack minority inclusion. And so definitely there's a benefit to having pharmaceutical sales reps that come from all different aspects of life versus just one population.
And when we speak about population, how do you think as a pharmaceutical rep you could actually go back into the inner cities or even the suburbs perhaps and empower genders versus female or even minorities to actually go to school and maintain perhaps a scientific degree?
Well, what I would say is that there are a lot of benefits associated with having enough credentials to be able to function in this capacity as a pharmaceutical sales rep. And the doors are often closed to minorities. So the more credentials you bring to the table, the more likely you are to have a better chance of succeeding in that environment.
And what door has been closed in your face?
Well, once you're in the industry, it's a very competitive industry, but it's also again, lacking a lot of diversity as relates to a minority representation in the sales force. And for the company that I worked for, which is the second largest pharmaceutical company in the world, for example, our region, which consisted of 6 states, only had 6 blacks. So there's definitely an imbalance in terms of the numbers of minorities that are being represented.
And when you say the imbalance, would you say the problem is that perhaps minorities are not applying? I mean, what are the statistics and prerequisites of a minority or an Anglo-Saxon applying?
Well, the prerequisites should be the same, but I find very, very frequently that I was approached by other minorities that would say, I've tried for years to get into this industry, what does it take? And then you find, once you're inside the industry, that a lot of people that apply for the positions kind of went through the back door. So they have a system of nepotism or recruiting from within, by word of mouth, through a manager handing an application to another manager that never even went through the actual hiring process. So they certainly aren't given the same advantage because a lot of the hiring takes place internally in the absence of the applicants actually going through the hiring process.
Well, then how can, as you say, a minority take that advantage and just be diligent themselves to say when perhaps utilize and see me as a physician, if you were walking into my door and there was other race of a gender pharmaceutical rep, what would you do to stand up and say, I need to be the one, doctor, for you to sign the signature to give this to your patient?
Actually, I would say that there should be a nice complement of pharmaceutical sales representatives that all bring something to the table, and I don't think that that's necessarily included in just one population. And if they're never afforded the opportunity, well, they'll never have an opportunity to see that there's a benefit. You do have a significant amount of minorities that are represented in their patient population, and sometimes it's just difficult for them to transition from, or their staff to transition from having discussions that they're not comfortable with that relate to race, and there's a benefit to them having someone that they can identify with.
But wouldn't you say that a pill is a pill, from like Coumadin, it's blue, warfarin, hypertension, most of them are seen as white tablets. So how do you mentally prepare yourself as a pharmaceutical rep to be aggressive and go in and say, we will break the barrier?
Well, I think persistence pays, and I think you definitely have to apply yourself in a manner that you have to be consistently pushing the envelope, because the doors are definitely closed, and if you're not persistent, you'll never get in.
So with that door closing, what are you going to do as a pharmaceutical rep to go back and reopen it so that other young men and women coming up the ladder can say, I can sell that pill also, rather than not on the streets, but legally.
Bringing the awareness to the physicians, having a lot of relationships and saying, hey, haven't you heard the story repeatedly from people that there are barriers associated with them getting into the industry? Is there anything that you can do to say that, we're open to all applicants, not just one particular type of applicant. As long as they can bring the same credentials to the table and they're capable of doing the job, that's all that should matter.
And that is true. So I thank you for coming today, and please continue to do all that you can do to maintain the standards. I'm Vivian Grant with God's Crew. Until next time.